heart rate variability is something that people in sport have known about for a very long time, is a skill that you can very quickly acquire and will allow you to use that relationship between the phrenic nerve, the diaphragm, and the size of the heart volume and all that stuff to really take control of heart rate quickly. We should talk about the relationship between breathing and heart rate. This is an incredibly important topic, so much so that I perhaps should have brought it up at the beginning of the episode, but nonetheless, you now know what your diaphragm does, right? When you inhale, your diaphragm moves down. That's right. When you contract your diaphragm, it moves down. It creates space for your lungs to inhale. And when you exhale, your diaphragm moves up. Well, when you inhale and your diaphragm moves down, what happens is there's more space created in the thoracic cavity, in particular if you're also breathing deeply and you're using those intercostal muscles to expand your ribs. As a consequence, the heart actually gets a little bit bigger. It's a temporary enlargement in the heart, but it's a real enlargement. And as a consequence, whatever blood is in the heart is now in a larger volume because the heart got bigger. And as a consequence, that blood is moving more slowly through that larger volume for a short period of time, but nonetheless, it's moving more slowly. Your nervous system detects that and sends a neural signal to the heart to speed the heart rate up. In other words, inhales increase heart rate. The opposite is true when you exhale. When you exhale, your diaphragm moves up, your rib cage tends to move inward a bit, and you compact the heart. You reduce the volume of the heart overall. When you reduce the volume of the heart overall, blood flow through the heart accelerates because it's a smaller volume. So a given unit of blood is going to move more quickly through that small volume. Your nervous system detects that and sends a signal to slow the heart down. So just as inhales speed the heart up, exhales slow your heart rate down. What does this mean in terms of controlling your heart rate? Well, let's say you are going in for a blood draw or you're going out on stage and you're stressed. Well, I would encourage you to do a physiological sigh, maybe 2 physiological sighs to bring your level of calm up and your level of stress down. Nonetheless, if you have any reason why you want to quickly reduce your heart rate or accelerate your heart rate for sake of physical work output or to calm yourself down additionally, not just use the physiological sigh, well then you can take advantage of this relationship between inhales and exhales and controlling heart rate. If you want to increase your heart rate, you can simply inhale longer and more vigorously relative to your exhales. And if you want to decrease your heart rate, well then you're going to make your exhales longer and or more vigorous than your inhales. If you wanted to equilibrate your heart rate, what you would do is you would do box breathing, because inhale, hold, exhale, hold is by definition creating equal duration inhales and exhales of essentially equivalent vigor. And it really forms the basis of most all breathing practices. When you do a physiological sigh, you're doing 2 big inhales, which is going to speed your heart rate up just a little bit, but then a long extended exhale. The exhale in the end is much longer than the 2 inhales even when combined. And so you get a net decrease in heart rate, the calming effect. And then practices such as Tumo breathing or Wim Hof breathing or cyclic hyperventilation, deep inhales and exhales, the inhales are more vigorous compared to the more passive exhales, are going to lead to increases in heart rate. Okay, so the relationship between breathing and heart rate is an absolutely lockstep one where your heart rate follows your breathing. Your heart rate and your breathing are in an intimate discussion with one another, but where always and forever your inhales increase your heart rate, your exhales decrease it. Now this feature, which physicians call respiratory sinus arrhythmia, or we sometimes hear about more often nowadays as heart rate variability, is something that people in sport have known about for a very long time. It's why, for instance, that marksmen will exhale just prior to taking a shot. That's particularly true for people that compete in the biathlon, where they cross-country ski, so their heart rate is up, 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 up. Then they'll get to the point where they actually have to shoot at a target, and they'll exhale, and then they'll shoot the target. This is also why, for instance, if you want to bring your heart rate down very quickly between rounds of martial arts, there are a number of different ways to do that, but an extended exhale of any kind, or frankly, any breathing practice that emphasizes exhales, is going to bring your heart rate down. This has been incorporated in a number of different contexts, including sport, military. It's also now being incorporated in a clinical context for people who feel a panic attack coming on. I'm very gratified to learn that the physiological sigh is now being explored as a tool to prevent panic attacks and anxiety attacks. This is prior to the panic attack, people bringing their heart rate down again through those extended exhales. So learning to extend your exhale is really a terrific skill to master, and it's a very easy skill to master, frankly. Why do I say a skill? Well, remember what I said earlier, which is that humans inhale actively and most typically will passively exhale, just let the air drop out of them at whatever rate, depending on how much air they inhaled. Actively exhaling, that is actively relaxing the diaphragm and actively relaxing those intercostal muscles of the chest, those ones, or I should say between the ribs, is a skill that you can very quickly acquire and will allow you to use that relationship between the phrenic nerve, the diaphragm, the size of the heart volume and all that stuff to really take control of heart rate quickly, so that if you feel like your heart is racing too much, and frankly, a lot of people have a lot of what's called interoceptive awareness, especially anxious people. They can really sense what's going on in their body. Other people less so. Like, oh my God, my heart's beating. It's ready to jump out of my chest, and I don't like that. Big, long exhale. Doesn't matter if you do it through the nose or the mouth. Big, long exhale is going to allow you to slow your heart rate down.